I forgot Jay, sorry.
Now we're good.
Okay, great, thank you. Good afternoon and welcome to SSM Health Greater Fond du Lac. I'm Dr. Richard Schaefer, a board-certified plastic surgeon with SSM Health Fond du Lac Regional Clinic. Thank you for joining us as we celebrate our 1,000th patient using an innovative ultrasound-guided carpal tunnel release. An estimated 13 million people in the United States are impacted by carpal tunnel syndrome every year, causing pain, numbness, and disability in the hands. And through an innovative real-time ultrasound-guided technique, we've been able to provide relief to over 1,000 patients now. Nearly 3 years ago, I was proud to become the first physician in Wisconsin to offer this and remain the only provider in Wisconsin that has been recognized as a National Center of Excellence of this technique. Since this technique is completed using real-time ultrasound guidance, we're able to perform this through a very small wrist incision, and usually the incision is so small we're able to do this without any suturing, and patients can return to activities within 1 to 3 days and return to work within 3 to 7 days. This is all done under local anesthesia only, so patients can drive themselves to and from their procedure. I perform this procedure in Fond du Lac, Ripon, and Waupun, and it is covered by all major insurances as well as Medicare. I'm truly honored to reach this milestone and am humbled that I've been able to bring this technique to the communities I serve. I'm grateful that this less invasive approach has been able to impact so many lives. I would like to introduce one of those patients, not perhaps our 1,000th patient, but one as equally as important, Dr. Stephen Sobek, who is no stranger to healthcare, and as a patient of mine has experienced carpal tunnel release both with an endoscopic technique and now more recently with an ultrasound guided procedure. Dr. Sobek.
So back in 2021, I developed carpal tunnel syndrome in both my hands, and after consulting with Dr. Schaefer, we decided to perform the first surgery on my right hand with the traditional endoscopic surgery, and then later do the left hand with the new ultrasound guided approach. So the endoscopic surgery is usually performed with anesthesia for sedation, so the patients are more comfortable and they just snooze or sleep through the procedure. Being a physician and anesthesiologist, I opted not to have sedation just because of the fact that I'm a physician and maybe know better, or don't know better, actually. And the procedure went really well. Everything went fine. It was very successful, and I had good relief of my symptoms, although the procedure would be a little bit more comfortable with sedation, and that's why most people will typically opt for it. The recovery, though, was a little bit more intense than I thought and expected it to be. It took a good week before I could use my hand to really any significant capacity without a lot of discomfort, and it took me about 2 weeks before I could return to work, and even then still with some discomfort on a daily basis with normal activities. All in all, it took at least a month to 2 months for me to kind of feel back normal and not have any pain or discomfort. So the recovery was a lot more than what I expected. But with the ultrasound procedure, it was a night and day difference. The procedure, like Dr. Schaefer said, is performed without sedation, with just local numbing medication, and it's pain-free. I felt nothing. It was fantastic. I was in and out very, very quickly. And that same day, I was able to use my hand. Really, it was only a little bit of discomfort. So I was able to get back to my normal activities same day, and within a week, I was almost back to normal capacity. And then also returning to work too was no problem. I think a week later, I was back and just doing everything I needed to do at work without problems. So I'm extremely grateful to Dr. Schaefer for bringing this procedure to Fond du Lac and for his expertise in it. I really believe that both he and this procedure are a great blessing to our community and the organization and all the patients that we serve. So I thank him very much for helping with my symptoms and doing a very good surgery on me.
Thank you, Dr. Sobek. Thank you for sharing your story. I know that people who have carpal tunnel syndrome are there are millions of them out in the community and are often on the sidelines not wanting to have an operation because they are intimidated by the time off of work. But you know, we are able to get people back to their lives quickly and as comfortably as possible. I really believe that this is the best way to treat carpal tunnel, not only from a therapeutic and effectiveness, but from a patient experience ways. It's just, I think, that the best way to get it done. I'd like to just open it up for any questions from the audience before I conclude.
Have you seen more people suffering from carpal tunnel syndrome in recent years as we all become more tied to our computers and phones?
I do think that you know, so many of us are on our phones, and that phone use is a big complaint that people come in with, saying that they're having symptoms while using their phones. It's very common.
So you think there's been more in recent years, or has it kind of been staying the same?
I do think that the prevalence of carpal tunnel, I don't think has changed tremendously, but I think, you know, when people notice their symptoms is phone related. Yes, sir.
Will it go away on its own?
Carpal tunnel syndrome does not go away on its own. Does not go away on its own.
Even with rest, or?
There's always going to be a hedge in any medical answer, but in general, carpal tunnel syndrome is not cured by rest.
Can you explain in a little more detail the difference between how the procedure used to be done and how it's done now with the new technology?
Absolutely. So the classic operation was about a 1-inch incision in the palm of the hand to go down to the structure deep in the hand called the transverse carpal ligament that is causing pressure on the nerve. And the treatment is to release that ligament to take the pressure off your nerve. And through the new technique, we're able to see that ligament with ultrasound, and then very carefully insert a device underneath that ligament and release it from underneath, thereby keeping the incision off of the palm of the hand and allowing for a speedier recovery.
Is there anything people can do to kind of lessen the tension that causes carpal tunnel syndrome?
Many times patients will start with splints, sometimes daytime splints or nighttime splints. Many patients do have nighttime symptoms, and any basic wrist splint that holds your wrist in a neutral position, the kind you could buy at, you know, Walmart or any basic pharmacy, many patients do find that those help control nighttime symptoms, but many patients still continue to have breakthrough symptoms despite splint wearing.
What are some things people can do to prevent getting carpal tunnel?
Some of it is preventable and some of it is not. And I think it really just depends on the root source of why you're developing it. So functionally, the problem is a pressure problem inside your wrist, and you can try stretching exercises to try to release some of that muscular tension. If you have a flare of acute carpal tunnel because you were doing a very, say, large home improvement project that is atypical for you, you might get symptoms of carpal tunnel syndrome that do improve when you stop that project. But for most people who just have that slow, chronic, insidious onset of the disease, there's really no way to undo that.
Are you more likely to get it the older you get?
Yes.
Can you explain more what's happening in the body when someone starts to develop those symptoms?
So there's a high pressure inside the wrist, which is squeezing on the nerve. And when you put your wrist in certain positions, you change the size and dimensions of the carpal tunnel. If the wrist is in a neutral position, like this, that's sort of as large as you can make your carpal tunnel. And when you start to flex your wrist or extend it, then you make your carpal tunnel smaller, driving the pressure up inside your carpal tunnel, squeezing the nerve, functionally squeezing the capillaries of your nerve so much that the blood flow inside the nerve is impaired, and then over time that leads to breakdown of the myelin fibers of the nerve itself.
So why do some people get it and some people don't when they're doing the same actions?
Right, and that is one of the great mysteries. Why can some people run the 100-meter dash in 10 seconds and other people take 40? Any other questions? I do have an ultrasound machine over here and the device if you'd like to see some images. So this is an image of a wrist. You can see the skin is on the outside, the median nerve in the middle. The median nerve is the nerve that's implicated from carpal tunnel. This is a bone of the wrist called the lunate, and this white line above the nerve is the transverse carpal ligament. This device is carefully inserted inside the carpal tunnel. There are some balloons on the device that inflate to protect the nerve, and then we're able to release that nerve from the inside, release that ligament, taking the pressure off the nerve from the inside.
Any questions of Dr. Solberg, or, yeah, Solbeck?
I have a quick question.
Yeah.
I don't know if you wanna stay over there or
Yeah, sure.
go. So what would you tell people who are maybe, other patients who are maybe concerned about this new tech?
I think their concerns can be easily assuaged by the fact that it's a very pain-free, simple, quick procedure. You're in and out very, very quickly on the same day, and the recovery is very, very easy compared to the traditional approach. Not that the traditional approach was bad or unnecessarily difficult, but it's the technology being different and new and less invasive even than the endoscopic approach is just dramatically good. So if people want to return to work or to their lifestyle much sooner, then this is definitely the approach to go. And obviously the benefit to your lifestyle is substantial too. Instead of having to suffer with daily, nighttime symptoms, waking up in the middle of the night with pain and numbness in your hand and not being able to do things you want to during the day, and then also the fact that it can lead to kind of long-term negative effects on the muscles of your hand too if it's not treated for a long period of time. It's definitely worth undergoing this procedure so that you can have recovery.
Any other questions? Thank you all for being here today.
Let us know if you'd like
Thank
to
you,
get
guys.
any